Hi, I'm Franziska Tachtler and I'm a PhD student at TU Wien. Today I'm presenting the paper Supporting the Supporters of Unaccompanied Youth, Designing for Social Ecological Resilience. This paper is co-authored with Toni Michel, Petra Slovak and Geraldine Fitzpatrick. Unaccompanied youth are fleeing to a new country without their parents and are exposed to mental health risks. Thus, unaccompanied youth could benefit from mental health support to guide them in developing strong resilience skills. Psychological resilience refers to the ability to adapt in the face of adversity, trauma, threats, or stress, and reduces negative mental health outcomes. However, systemic and personal barriers hinder unaccompanied youth accessing mental health services. While there's a growing evidence that technology could support the delivery of mental health intervention, there's a lack of mental health technology that would directly address the needs of refugees. As a first step, we investigated how existing support structures promote resilience in unaccompanied youth in order to identify opportunities for technology-enabled support. We conducted interviews with 5 unaccompanied youth, 18 professional and volunteer support workers spread across social work, education programs, mental health promotion, and mentoring programs. As unaccompanied youth flee without parental support, some NGOs organize volunteer support workers to act as mentors through different types of mentoring programs. We learned that volunteers acting as mentors build up an important trust relationship with the youth. We also learned that a highly functioning and trusting relationship forms an important basis for discussing mental health and promoting resilience. Thus, trust relationship between mentor and mentee could provide a good basis for resilience promotion and delivering related mental health interventions. However, there are challenges because the mentors feel overburdened with their role. To deepen our knowledge about the mentor's challenges and support practices, we conduct 3 co-design workshops with volunteer support workers. The workshop was framed as being about developing a guidebook for new mentors, and this constructive, forward-looking way enabled them to articulate and capture support approaches they themselves found successful. The results show that the mentors face many complex challenges in supporting the youth. We identified several struggles regarding the mentor's own well-being. For instance, the mentor struggled with the high expectations toward themselves and worry that they are not able to solve all of the mentee's problems. Another challenge for mentors regards providing direct mental health support, which includes recognizing mental health symptoms, discussing mental health, and providing support. In addition, there are network-related challenges. The coordination of care between different professionals and volunteers who care for the same youth does not function well, and the support structure for mentors is limited. Even if the exchange between mentors seems to be highly beneficial, the exchange regarding similar challenges is limited. In seeking to make sense of these findings and address the entailed challenges, we argue for the value of the social ecological model of resilience. First, it provides a theoretical account of our findings and a framework for designing resilience promotion from an ecological rather than an individual approach. In a social ecological model of resilience, the environment is most facilitative of resilience if the individual, namely the supporters and the supported young person, can easily navigate and access resources and apply appropriate and culturally meaningful resources and expertise. The exchange inside and across systems functions well. Solutions as well as the supporters' well-being and capacity to support is supported for the long-term sustainability. The mentors struggle with providing mental health support as they encounter challenges across all the aspects of the social ecological model of resilience. They struggle finding and accessing resources and expertise. Even when the mentors manage to find resources, they are insufficient to meet the mentees' needs, and the mentors struggle with promoting the well-being of their mentees in the long term. Thus, the characteristic of a social ecological model of resilience where individuals can easily navigate resources that they can apply to their specific situation is not fulfilled in this context. There's a clear gap between the coordination of care and the sharing between mentors caring for different youth, which decreases the quality of care. Thus, the exchange between different systems does not function well. The mentors struggle with empathy stress, high expectations towards themselves, and feel overburdened by their role to provide mental health support. Their own mental health is at risk, which threatens their ability to provide stable support in the long term. Second, the social ecological model of resilience provides lenses to help structure pathways of interventions to map out the application areas for technological support. We can interpret our findings through the lens of the different systems identified by Bronfenbrenner's ecological theory of development for children. In the scope of this work, we emphasize the 3 systems in which the mentors play an active role. In microsystems, the young person, in this case the unaccompanied youth, is directly involved, for instance the mentorship. Mesosystemic processes describe the interactions between microsystems. The quality of interactions between the microsystems contributes to a better mental health outcome. For instance, an effective exchange between mentors, social workers, and teachers to support individuals' development. The exosystem concerns the many different distal social interactions that indirectly influence the quality of meso and microsystemic interactions, and therefore affect young people's resilience. For instance, effective community support for mentors positively influence the quality of the mentor-mentee interaction. Third, the social ecological model of resilience provides a conceptual structure to inspire novel design solutions by drawing analogies to existing work from different contexts that have targeted similar interventions and support models. In our work, we look at 5 specific intervention points which deal with the mentor's challenges and needs. Technology could facilitate navigating and applying resources and thus enable the mentors to provide better direct mental health support for their mentee. Technology could support coordinating care of the same unaccompanied youth. Technology could strengthen the exchange between the different social support systems. Technology could connect mentors with other mentors and experts, such as mental health professionals, by matching based on the mentees' backgrounds and struggles and facilitating both online and offline exchange. Technology could contribute to sustain the individual's capacity and well-being. For instance, technological features in peer support system could protect the mental health of the individual actors and point to mental health strategies the mentors can self-apply. Each of the design directions support the characteristics of a facilitative environment in a social ecological model of resilience. Even if some HCI projects can be interpreted as including elements of the social ecological model of resilience, the social ecological model can further be used to deepen the understanding of the different systems and interrelationships which take a key role in providing support. Especially other research has also proposed the capacity of networks, for instance, via peer support systems. A social ecological model of resilience further suggests that not only the systems need to be resilient, but also the individual actors in the systems to be sustainable in the long term. Overall, the social ecological model of resilience provides a framework to promote resilience of mentors who in turn can help promote resilience of the unaccompanied youth, namely by helping the mentors to deal with their challenges, to create together with the support of the different systems an environment where the unaccompanied youth can thrive, and to stay mentally healthy in the long term. I would like to thank my co-authors for all their contributions, the European Union's Horizon 2020 Research and Innovation Programme for supporting this research, and all youth and professional and volunteer support workers that participated in my studies. Thank you for your attention and don't hesitate to contact us if you have any questions or comments.